Hello everyone, good morning, good afternoon, good evening, wherever you are seeing me from. My name is Deborah Wilson. I'm a nurse and midwife by profession. I'm also the founder and the president of Enablers Diaspora Grassroots Support Outreach Worldwide. On this short clip, I just want to talk about a condition known as deep vein thrombosis. So what do we mean by deep vein thrombosis? Is otherwise another term for it is DVT. DVT occurs when there is blood clots, when there's blood clot formation in one or more of deep veins in the body. I repeat, DVT or deep vein thrombosis occurs when there is blood clot formation in one or more of deep veins in the body. And DVT can be very life-threatening and can cause leg pains and swelling. And blood clots in the leg may cause pain. It might make the leg become warm and tender, most especially on the affected leg. A blood clot can also develop if you don't move after a long period of time, or when you're on a bed rest, maybe as a result of surgery or illness or an accident. What are the symptoms of deep vein thrombosis? The symptoms of deep vein thrombosis includes leg swelling, as I said, leg pain, soreness. This often starts in the calf of the leg. And also there might be skin discoloration, and also the feeling of warmth on the affected leg. So when we have to see doctor, you need to see doctor as soon as possible if you experience the following. If there is sudden shortness of breath, please make your way to hospital. If you experience chest pain or discomfort that worsens when you take a deep breath, please make your way to the hospital. If you feel fainting or lightheadedness, make yourself straight to the hospital, make your way down. If you have rapid heart rate or rapid pulse rate, and if you are coughing up blood, also if you are breathing rapidly or you are experiencing pain with deep breathing, please make yourself to the hospital, make your way to the hospital as soon as possible, because these are bad signs. And this DVT also leads to another condition that is known as PE in medical term. What do you shorten as PE? What do we shorten as PE? PE is pulmonary embolism. And what happened during when we diagnose pulmonary embolism? It occurs when a blood clots, when it gets stuck in one of the arteries in the lung, and this will block the blood flow to the part of the lung. And the blood clots, it often starts, as I said, it often starts from the leg. It travels through the right side of the heart and gets stuck in the lung. And this is called deep vein thrombosis. This might cause deep vein thrombosis. And this will prevent the blood from flowing properly and can cause blood clot as well. And also, I said if you have surgery or inflammation or any damage due to the vein, which might be due to maybe infection or injury, might cause DVT. What are the risk factors? What are the things that can make us prone to developing DVT, or what we know as deep vein thrombosis? Age is part of it. We can't rule out age because being older than 60 years of age increases the risk of developing deep vein thrombosis. Lack of movement is a major factor when the leg don't move. When there's reduced mobility for such a long time, maybe as a result of surgery, maybe as a result of injury, maybe when you stand or when you sit for such a long period and the calf muscle doesn't contract, it doesn't squeeze, and also as a result of paralysis or lengthy time or lengthy stay in hospital. This might make someone at risk of developing deep vein thrombosis. Also, injury or surgery. Injury to vein or surgery can increase the risk of having deep vein thrombosis. So also we cannot rule out pregnancy. In pregnancy, there is increase in the pressure. The pregnancy increases the pressure in the vein that is in the pelvis and the legs. So in pregnancy, when this increases, there's risk of developing DVT, which might last even till around 6 weeks after delivery. Also, our oral contraceptives, hormonals, they do cause they have ability to clot blood as well. And also, if you are overweight, if you are obese, unhealthy weight loss, unhealthy weight gain rather, there is risk of developing DVT. If you are a smoker, you are not left behind. If you are a smoker, you are at the risk of having DVT. Also, for somebody with certain cancer or you're on cancer treatments, there are few cancer medication or treatments that can prone someone to developing DVT, or can make someone be at risk of developing DVT. Also, if you have a heart failure or inflammatory bowel disease, something like Crohn's syndrome, ulcerative colitis, so you are also prone to developing deep vein thrombosis. And also, if there is a family history of pulmonary embolism or DVT, you are also prone to having it, at risk of developing DVT. And at the same time is genetical. These are the factors that can make one develop DVT. Now I want to talk about how we can prevent DVT. It's very preventable. DVT, we can prevent DVT by being active. Move your leg. If you know you have surgery, if you have operation, don't just sit down there and cross your leg. Try and move. Try as much as possible to move. Don't just cross your leg and have the race, because crossing leg and when you don't move, there's a tendency for your blood to clot, and this can block the blood flows to the heart. And when you are traveling, please, most especially long distance, make sure you have a short break, walk around, stretch your leg, place and place. It is very important. And if you are a smoker, please do endeavor to stop smoking, because smoking is another factor that can put one at risk of developing what we call deep vein thrombosis. And complications of deep vein thrombosis is pulmonary embolism, as I said to you. This is very, very life-threatening. And please make your way to the hospital if you suffer from maybe severe chest pain, shortness of breath, and if you feel fainting and you are coughing out blood, and there is rapid heart rate. If you experience these symptoms, please make your way to the hospital. And the treatment for DVT, what we normally do in the hospital is to give them blood thinner, but not just only blood thinner alone. There has to be regular blood test, and the result of that blood test will dictate the amount of blood thinner they gave. I do hope you've learned one or two things from this short clip. Please do subscribe to Enablers Worldwide. We're on YouTube, we're on Facebook, we're on Instagram, we're on Twitter. And do subscribe to our channel. I'll see you again. Thank you very much. God bless.